There is nothing like the excitement of holding a precious object from the past. Mrs. Brushfield's album holds a collection of photographs of Brookwood Asylum. Her husband, Thomas Brushfield, became its first superintendent in 1866. As he took up his new role, the first buildings were nearing completion. Brookwood was the second lunatic asylum in Surrey, the first having been built at Wandsworth some 20 years before. Dr. Brushfield started with enormous enthusiasm to specify the kinds of furniture, the materials, and even the ornaments to be purchased for the new institution, together with the cloth to make clothes for the asylum inmates. We open the album, and here are the buildings. In 1866, a huge monolith dominating a landscape of scrub and gorse. Among them a chapel, where we see inmates and attendants at work nearby on the harvest. Later photographs show how this rather bleak landscape developed, as gardens were planted with shrubs, an assembly hall and hospital were added, creating a sense of ivy-clad Victorian respectability. It is fascinating to look at the photos of the interior of the buildings. Both men's and women's wards are decorated with vases, occasional tables, mirrors and statuettes, for Dr. Brushfield believed that creating a pleasant and homely atmosphere would promote recovery for his patients. There are photos of the asylum band, attendants in uniform with brass and wind instruments, and of the assembly hall decorated for Christmas. Doctors and staff put on weekly concerts and plays for the patients, as well as the New Year's ball. In the summer, the anniversary of the founding of the asylum was celebrated with a picnic for patients on the common outside the asylum. But the most intriguing of all are the photographs, which show some of the people. Here are old lady patients in plaid shawls, whiskery old men, thin young attendants with caps and keys, awkwardly posed doctors' children with their small dog. It is uncertain who took the photographs in Mrs. Brushfield's album. It is quite possible that some were taken by Dr. Brushfield or Mrs. Brushfield, but I can imagine Mrs. Brushfield selecting the images and carefully putting them in. She may well have used it to show friends and potential benefactors what good work was being done. What shines through these images is pride in the beautiful new buildings and a sense of purpose in the humane treatment they sought to offer.